Hi, everyone. This is JJ Schuyler, the Executive Director with NCIMS, the North Carolina Integrative Medical Society. And I am so excited to be here today with Cathleen King. She is a doctor of physical therapy and she is a neuroscience-based mind-body practitioner. She focuses mainly on chronic illness and trauma healing, and she is the CEO and founder of Primal Trust Academy and Community. So, welcome, Kathleen. Great
Thank
to
you.
have you.
Thanks. Good to be here.
So, we like to do these interviews as we head into our Southeast Regional Integrative Medicine Conference, and we're so excited to have you as a guest speaker, as a pre-conference speaker. We're featuring the Tuesday prior to our conference in June. So, welcome, and we love to just take a couple of minutes and let our folks get to know our featured speakers. So, tell us a little bit about you and how you found this work.
Sure. Well, I found it in the way that a lot of self-healers don't want to find it, which is by going through a lot. I spent many years very ill, actually over a decade, and a lot of the time I was bedbound. But I also had an education before I got ill. I was a physical therapist, but I really focused with a lot of mind-body medicine, chronic pain. And so I had this understanding of the mind body. I was a manual physical therapist. I worked a lot with instability and issues like that. But then I became ill with all sorts of different labels, ranging from Lyme disease to mold illness to chronic fatigue syndrome and viruses and parasites and all the things. And I went down a dark road for a while. I was very frustrated. I went from doctor to doctor and protocol to protocol, and eventually, lost all our money. And I had full-time care for my kids, and I was living in a dark, quiet room and felt like my life was just slipping away. And I eventually kind of came back to my roots as a physical therapist. I thought, chronic pain is modulated in the brain. And as much as people have these injuries all over their body, my job as a physical therapist at that time was to really help people find their power and to learn how to modulate all of these injuries with a brain-based approach and with a nervous system-based approach rather than just focusing on, oh, you've got this knee pain, shoulder pain, back pain. There was a holistic approach. And I thought, what is the common denominator with all of these illnesses that I have? Could there be a holistic approach here rather than this pathogenesis approach, meaning what's this infection and what's this lab test saying and now this toxin? And I'm like, what is the common thread? Because this is getting crazy making. I've gone to some of the best doctors in the country and they're just like playing whack-a-mole with my body. And I can't afford to do this anymore. And at that moment of just asking a different question, like what's going on in my biological processes overall that is making me susceptible, I had a different understanding come in. And I realized that the brain and the nervous system run the show, just like they did with chronic pain. And the funny thing is that I had lots of great brain body exercises that I could have been doing for over a decade, but I didn't do them because I didn't have chronic pain. I had real infection. I had real toxins. I never put the pieces together from a holistic standpoint. Once that awareness came in that the brain and the nervous system are modulating my immune system, my ability to detoxify, my epigenetic signaling, I was like, I need to take this approach. And I did some research. And sure enough, I found other people were self-healing from these incurable things or these complicated things with, massive nervous system regulation or trauma healing practices. And sure enough, for me, I started implementing things like brain retraining, functional neurology, which is a way of targeting the vagus nerve and the way that our brain communicates, somatic practices, and even some trauma healing practices. And my chronic symptoms of well over a decade started to slip away. And I was like, okay, this is amazing. And I started working with people, coaching them. I never went back to be a physical therapist. I started working with the chronic illness community. And I started gathering a lot of data like, okay, this was my story. This is how I'm self-healing. But what about others? And I learned as much as I could. And over time, I found the theory of the cell danger response probably 5, maybe 6 years ago, before anyone was even talking about it. And I remember reading about it. I was like, oh my gosh, this is it. This explains the common denominator that is happening with all of these different chronic illnesses. It is a body, a nervous system, a cellular system that is stuck in protection and distress. And, you can try bugs or detoxify, but if your cells are hunkered down in a cell danger response, it's hard to make a whole biological system shift. And so the cell danger response really became my cornerstone to explain why this nervous system work, trauma healing, and all of these things helps a variety of illnesses, and why you don't have to focus fully. I don't really need to know what people's diagnoses are or their lab tests are to help them heal, because I'm looking at their biological mechanism. Now, it doesn't mean that they don't do integrative medicine, because in fact, when you start working on the nervous system, integrative medicine works even better. And so that's how I launched the Primal Trust Academy and community. And that's why I teach what I teach, is I'm really helping people from a biological perspective out of cell danger response by targeting their brain and their nervous system and their trauma.
Awesome. Sounds like you've had such a great journey. And I mean, how fortunate are we to have you, because you can speak from it a personal efficacy standpoint, as well as all the people that you've now trained and helped heal, right?
Yeah, it's you always hope that there's some reason behind the suffering, like please let this be for some reason. It's definitely been a rewarding outcome. It really has, to be able to be part of this whole paradigm shift of chronic illness healing, and recognizing that we need to treat the body as a whole, that we need to look at the epigenetic signaling, the environment, and to be part of that movement. It's amazing.
Awesome. So, if you wouldn't mind, what can the attendees at the pre-conference workshop expect in June?
Sure. Well, I'd like to share with them a little bit of what I just talked about with my story, what brain retraining and nervous system work, what that is, and how that directly impacts the entire biological processes of the body, and how, as practitioners, if you can kind of take a step back as you're deciding a protocol, is this person stuck in cell danger response? Meaning, if I start going after them with all of these killing agents and detoxifying agents, are they going to just maybe have an adverse effect because their personality is somewhat of a protected, very scared personality? And what other ways can I start to think about helping them shift out of this danger response by giving them some things that they can do at home, or helping them find nervous system programs? Why that matters, and why, in my opinion, I think almost every protocol needs to involve a home self-regulation practice to keep them, even if they're not in cell danger response, to keep them out of that with some of these intense protocols that are being given with these complex illnesses that we're seeing today. And then also to understand that, if you're not familiar with cell danger response, it's a crucial priority. It's something that, really explains why we need to be approaching things differently than we are.
Wonderful.
Meaning not just finding all of the infections, but what is going on, holistically in the cells and in the mitochondria.
Great. Well, I think that fits in so nicely with the integrative medicine paradigm in general, right? Because our community of practitioners, they're so invested in helping empower their patients as they're treating them. It's more of a collaborative thing than maybe what traditional
Yeah.
Western medicine
Yeah.
patients are accustomed
Yeah.
to experiencing, right? So there's a lot more of an empowerment approach, I think, with
Yeah.
this.
Yeah. I'm seeing that too. And that was a big shift from when I was sick. I mean, I saw lots of naturopaths and things like that, but they were still they were in the whack-a-mole game still. Not a single one of them mentioned my nervous system or doing nervous system work. I definitely never heard of cell danger response. It was like, okay, now this test came back this way, and we got to try this protocol and that protocol. And I was just going downhill, and they never stepped back and was like, wow, this girl is so scared all the time. no wonder she can't detoxify or even handle these homeopathics I'm giving her. But that's really shifted in the last several years. I really see, which is so exciting that,
Mhm.
practitioners now, I mean, of course, in the Western system, that might not have shifted. They're like, I don't know what's wrong with you. These things don't show up on lab tests. This must all be in your head. But from the integrative approach, things are changing. We're understanding that we need to be focusing on patients more holistically, and which is why I love being involved in a conference like this to just continue to help that awareness.
Oh, great. Well, we are super happy to have you join us in June. And everybody, she is going to be doing this virtually for us on the Tuesday prior to the conference in June. So the pre-conference in person starts on the Thursday before, and then we'll be there Friday and Saturday for the main conference. So that is June 14, 15. And so the pre-conference in person is the 13th. And so that means that Kathleen will be with us on the 11th. So be sure to tune in for that. If you have not already signed up, ncintegrative.org, you can find more information. But thank you so much for your time today,
Yeah,
Dr. King. We really
absolutely.
appreciate it.
Thank you. Look
And
forward
I
to
cannot
presenting.
wait for your program in June.
Awesome. Thank you.